Hello, everyone, and welcome to another episode of The Founder Files. In today's topic, we're going to be talking about health, and something that I know is so critical towards entrepreneurs, but something that many of us don't take proper care of. And for that reason, I'm talking to Emilian Popa. He is the founder and CEO of Ilara Health. Now, Ilara is based in Kenya, and what they provide is low-cost diagnostic equipment and a practice management platform to all of the informal/formal clinics in Kenya. And they've been able to scale over the past couple of years, and the business has gone through these evolutions of starting off as just diagnostic equipment on lease to being a full-fledged practice management solution, and they're even acquiring these practices, becoming private equity. Fascinating business that he's been able to grow, and the way that he explains it is there's a lot of simplicity that he uses to cut through this complexity. So this is going to be a really good conversation, and in this conversation we chat about how his product and offering of the business has evolved, but also how he was clear about what he wanted in the beginning and broke it down into small pieces instead of trying to make his vision a reality too quickly. He speaks about the uniqueness of product market fit in different parts of his business. We've got different product market fit, how he defines that, how he grew that. We obviously speak about the nature of healthcare and infrastructure within Africa and the challenges that come with that, but also the solutions and opportunities that founders bring. We then speak to the management layer within his company and just putting together leadership and management within a business that you can really trust with responsibility. This really segues the conversation in terms of really understanding Emilian more as a founder and his thinking about his ability to trust, his ability to have a sense of calm and low levels of anxiety within his business as he's building it and growing it and building a second business and flying all over the world. And it all really comes down to what, a good chunk of the conversation turns into is just health. Right? And he walks the talk a lot in terms of making sure that he's sleeping well, making sure that he's exercising properly, and sleep being the biggest one. So a lot of the conversation goes into how does he as a founder manage his health? How do we as founders need to think about our sleep and take care of ourselves better? There's so many insights and principles that we get from this conversation just around managing health, being a leader, being an entrepreneur, and really trying to live a life where we have a sense of freedom and autonomy, but really enjoying the journey at the same time whilst building a business. And we get into all of this. So this is a podcast that's filled with so many nuggets and topics that are important to us as human beings, as well as business people. Now, one thing I'd love to ask is that for you as an audience member, is we are on the pursuit of coming towards a wrap-up of season 4. Now in 2024, we're going to be moving to season 25 next year. And we really want to engage with you to find out more about what is it you enjoy, what do you not enjoy, what is that you want to hear more of, what kind of topics do you want to focus on? And I really want to give an opportunity to really reach out to you to find out more about what you want to see in this content and help me curate the right content. And just on what I've mentioned now, these subtopics, whether it's burnout, whether it's about health, whether it's about putting a management layer together, we've put together an insights vault of everything in season 4 now, where we've put these timestamps from all these YouTube videos when founders specifically talk about how they manage their burnouts, how they manage their management team. And we've put this together into this vault and this database of all these insights so that if you really want to jump towards these topics and find these lessons from multiple founders, you can. And so anyone who's going to help us out by answering the survey and helping us put together season 5, we're going to give you exclusive first access to this Insight Vault to say thank you so that you can cut through the noise of all the longer podcasts and get the insights that you really want. So if you want to do that and help us out, please follow link in description below. But without further ado, on the topic of health, on the topic of scaling, ladies and gentlemen, Emilian Popa. Welcome to The Founder Files, the podcast that's like eavesdropping on a conversation with a successful entrepreneur over a fireside chat. Join me, Cameron Coots, through this unique experience of unfiltered stories and insights from scaling founders around the globe as they share their ups, downs, and everything in between. Hey Emilian, welcome to The Founder Files. I'm very excited to have this conversation. When we were preparing and chatting offline, we spoke a lot about health and your own journey in health. And me, it's a huge topic in my life now, whether it's my back or obviously my well-being. Being a psychologist, I care about well-being. So the fact that you're doing this at scale and the way we spoke about it is both ends of the pyramids in terms of the highly wealthy people, but also the people that don't have access to healthcare. You're really shifting what's happening on the African continent from a health perspective. So I can't wait to find out more about that and share that with our audience. So welcome to the show.
Thanks, Cameron. Thank you.
So just to give the audience perspective here, I mean, Emilian, you're obviously in multiple ventures, and you have been for a while. The two most prominent being Ilara Health and then Expand Health. But I think just for now, we're going to be focusing just on Ilara. I think we can give a little bit of time to the rest of them later. But just explain Ilara Health from a business and business model perspective. Because, I mean, you started off as leasing out diagnostic equipment to clinics in Kenya. You're now a platform business, and there's financing involved, and there's multiple sets of equipment. And it's become quite complex, but really multifaceted and really robust. So just tell me about how the business and the business model works.
Sure. So in a nutshell, at Ilara Health, we're building a technology-enabled network of primary care clinics in Africa. Now, why is that and how I've got here? So most of the African healthcare markets are extremely fragmented. So Kenya typically has about 20,000 small primary care clinics. I mean, a clinic is a shack with a hospital name. Just by comparison, if you Google how many primary care or how many GP practices are in England, there are 6,500, right? So 20,000 in Kenya, wow. Small country, and super small spend, 6,500 in England. All these small clinics are actually, or most of them, about 70-80% of them are run by nurses, so privately owned, run by nurse practitioners or nurses. There is a massive number, an inflation of nurses and nurse practitioners on the market because there's not enough jobs in the hospitals, right? In the public or private hospitals. So what these nurses do, they need to make money, right? They need to survive, and then they're going to all open a clinic. The challenge with this, or rather the advantage, is that there is access to care, right? When we said there is no access to care in Africa, well, there is a lot of access to care. You step in any street in the outskirts of Nairobi, you're going to find like 5, 10, 20 clinics right in that street. The problem is the quality, right? One small shack with a hospital name on top and a nurse practitioner consulting is not going to make a massive difference in someone's health. Mainly that there's a level of education of these medical practitioners is very, very low. So the access to care is a problem. So what we've done in Ilara Health from early stage, and what motivates me...
Before you continue, sorry, Emilian, I also remember you mentioning that it's not just necessarily because the access there, the availability is there, but the quality of the infrastructure, the equipment, but also just even outside of that behaviorally, if you're looking at Kenyans, is their spending on healthcare is some of the lowest in the world.
Absolutely. And that's an interesting number that I very often mention. So an American spends about $15,000 a year in healthcare, paid by insurance usually. A European, between 3 and 5. I mean, the northern you go get, the healthier people are, the less they spend. South Africans, about 450. It's about 7,000 rand, 8,000 rand. Kenyans, 70. Nigerians, 50.
Sure.
And it goes down. This is the whole care ecosystem. So from your GP to your pharmacy to your hospital, right? So what remains in the primary care, so your kind of GP level, is about $20. I mean, it's very little that one can do with $20 a year.
That's one consultation. Less than on average.
Well, actually, the consultations at this level of care are almost free, and that's interesting. That's also very different than other markets, where one would pay $1 for the consultation, couple of dollars for pharmaceuticals, another couple of dollars for any kind of diagnostics or procedures. So people end up spending about $7 every time they go to one of those small clinics. So then they go 3 times a year. That's your $20 or so per year. And that's privately owned nurse-led clinics. Public sector, I mean, there are public dispensaries, not in the cities, mostly in the countryside. They're not free. There's still, you still need to pay for something. But they typically don't have pharmaceuticals and diagnostics, so people end up still going to these privately owned primary care clinics.
Okay.
So to go back to the model,
you're talking about Ilara, yeah.
Yeah, go back to the model. So fragmentation. Fragmentation means, again, access, but poor quality of access. I still remember early days when I was going to see these small clinics and asking the owners, like, what is the biggest issue that you have? Or the biggest pain point, they're all telling me with no exception, we have pregnant moms coming and we don't have an ultrasound, so we can't actually offer them a pregnancy scans. Remember, these small clinics, actually, they do everything, right? They consult, they sell pharmaceuticals, they do some tests. It's like a micro hospital, if you want, into kind of one room. So pregnant moms, no way to scan them. Patients coming with symptoms of diabetes, but there's no diagnostic device to test for diabetes markers. But they don't even have blood sugar tests, or they definitely don't have hemoglobin A1C testers. So this got me back to the thing, like, they lack us, that they would need to purchase diagnostic devices. They can't go to the bank because the banks don't give them money. They have nothing, right? They don't own any property, so they don't have collateral, and they don't have education either. So the very first kind of Ilara iteration, which actually continues today to a big extent, is actually building this kind of flexible financing model where we would go to these small clinics, place on the desk of the clinician a portable diagnostic device on a leasing model or on a paper test model. This will allow the clinician to perform tests, so obviously make an impact into patients' health, and the clinician will make money and then will pay us a leasing fee. And this is not at all different that if you step in a Boots in London, in a CVS in the US, in a Clicks in South Africa, you will probably find a room in the back of the pharmacy where you can actually get some basic tests, right? So the model is not different here, or what we brought in other places in the world. So that's how Ilara started. So we literally blanketed the market. So out of these kind of 15,000 privately owned medical facilities, we've been working with about 3,000 over the past 5.5 years by giving a diagnostic device on leasing. And again, these diagnostic devices are mostly cover the basic tests. Again, people don't have money to go in and pay your whole 50 blood tests that you'd go when you do your kind of executive checkup,
or getting an MRI or anything like that. But I mean, that's obviously specialist radiology.
We talk about very, very basic stuff. So we talk about a full blood count, maybe a cholesterol, maybe a lipid profile if they have money to pay, maybe a liver, kidney panels if they have money to pay, but otherwise remains very basic, and obviously a bit of imaging, so pregnancy scans. So we've blanketed the country with, so we have about 3,000, we've been working with about 3,000 small clinics by leasing diagnostic devices over time. And then we realized afterwards that, diagnostics is only about 10-15% of the business of this clinic. They all make about $2,000 per month, just to kind of put this into perspective, right? So very little. And out of these $2,000 a month, diagnostics is about 10-15%. Pharmaceuticals is about 70%, so very different than a medical practice in a more developed market where you go and then get a consultation, and then the doctor gives you a prescription, and you go to the pharmacy next door and you buy your pharmaceuticals. These small clinics, they do everything inside, right? Again, we call them clinics, but the reality is a shack. It's a medical shack. So 70% of the $2,000 is pharmaceuticals, and they do some day procedures, day surgery. So we've covered the diagnostic side, so that kind of we increase that chunk of the revenue because now we place a diagnostic device, the clinician provides diagnostics. Now what else, right? So we continued about 2.5 years ago. We started also with pharmaceuticals to place pharmaceuticals in the shelves of these clinics, in the pharmaceutical clinics, on credit, but also straight sales. And over time, we realized that actually it's kind of like an investment model, right? You build a deal flow of small, a lot of startups. You test them with something, you give them something and see if they pay. But it's not enough, right? Because we couldn't make further investment decisions based on numbers, because there's no numbers, there's nothing. They have pen and paper. We can't due diligence them. So we built our own practice management software, which resembles to whatever you see in a doctor practice in a developed world, or even in a emerging market, in a proper doctor practice. So a tool which allows the clinicians to actually run their patients, mostly metabolic patients, run their business because it rebuilds their P&L, but allows us actually through the billing model and through the inventory model to have a view inside what's happening in that clinic. So eventually being able to due diligence that clinic and see their growth, right? So now, we've given Cameron a device. Cameron has been paying back on time or not on time. You start using our system. We start seeing your business. We start seeing growth or not growth. So when you say, Ilara, I want something more, or I want you guys to come and then place pharmaceuticals on credit, we can tell you, Cameron, based on your numbers that we see now, we can or we cannot do that, right? And over time, we've been topping up with different assets and tools in these clinics with a final goal of taking over the clinic or coming through, taking over all the revenue streams and eventually branding the clinic with our own brand, placing people there to train the clinician, and eventually achieving our end goal, which is bringing quality of care. Once we are there and now we're part of the clinic, we're not just a provider or a financier of an asset, but we're integral part of the business of the clinic through training, bringing all these supplies, having the data, having the tool running the clinic, etc.
So, Emilian, I love that story because it's very complex and it's very evolutionary over time. But one thing I want to know before I go down a rabbit hole of what I want to talk about, was that the vision from the get-go? From the beginning, you wanted to be truly embedded within these healthcare clinics, taking a significant level of control over them, and elevating the level of healthcare service that's being provided within your own brand. Was that the clear vision that you wanted from the beginning?
Yeah, it's interesting that you asked this question because early days, we had this kind of not logo, but like a motto. We're saying diagnostics is just the beginning. So we knew the diagnostics was just the beginning. 5.5 years ago, we didn't know exactly what's next, right? We found out, but what I knew at the time is that diagnostics was just a tiny part of what these small clinics need to become a better clinics. But the vision of kind of identifying the best clinician entrepreneurs in the neighborhood, and then giving them the tools and the means for them to become better clinicians and perform better was from day one. We just didn't know what other pieces of this puzzle will be needed.
So the reason why I wanted to know that is because it's so often that I find early stage entrepreneurs, it's so easy to see from the outside that it can be obvious in terms of just like be patient, break it down into smaller pieces, pick one thing, grow that, build that. And it's like, no, I've got this vision and I can see it now, but I need to make this a reality. And so instead of having 100 clinics on one thing, they'll have like 3 on like the full program, and then like use it as validation that they're on the right track, where it's like, that's not scalable or sustainable like now. And it's like, it can be something that gets in the way of building a great business. And for you broke that down into pieces in terms of really like, where do we start and how is it that we can get there? So what I want to know is that, like, given the fact that it's just mentally and behaviorally something that I see so often with entrepreneurs, it's like, and it's, again, we're all enthusiastic. Like everyone says, I can't do it, I'm going to do it anyway. It's like an entrepreneurial DNA. But you broke that down in terms of what makes the most sense to start with and then expand there. So how did you go about making that decision? Yeah,
actually, was the most important for me was what the clinician needs. What do they want, right? At the time, maybe I didn't even think what's the most important for us. Like, what's the most important for the client? What would make the client pay us back? And because of these individual clinicians, they live day by day. These are formal but kind of informal businesses, right? Whatever they make today, they're cash businesses. They make money today, they pay rent, they pay staff. They don't care of solutions which are long-term. They will not care about a system which will allow them to better run the clinic. It's nice to have, but the very first thing that they need something which makes them money today, right? What's that? It's something that they can sell. Either they sell a product, a pharmaceutical, or they sell a diagnostics, a test today, right? So, and that's how we build Ilara. Like, what the product is a device. I was very much coming from this mindset of, I believe that diagnostics are super important because measuring healthcare, measuring someone's biomarkers is super important to identify the treatment. I didn't know at the time that the spend was so little. So I didn't despite the fact that I did a lot of market research, probably I didn't get to the point of saying like, actually, just diagnostic is so small in the whole picture. But we started with something which made sense for the clinician.
But also it makes sense from the process perspective, is even for them is like, where does anything start? And if you're starting with them right at the get-go of a patient's journey, they're able to continue that just from a process perspective. So even though it's not like a huge spend and a big part of it, you're there when the journey starts.
No, 100%. I still remember there was another a story. In my early market research in 2018, I stopped into one of the a clinic of a chain. Like it's not a startup who has a chain of clinics here, and I pretended took an appointment. I made an appointment and I had a very quick consultation. I pretended that I had my painful throat, and without even asking me more or without doing any tests, they gave me antibiotics, and this was like, wow. Actually, this is the real problem, right? You need to test.
Yeah, I just lied to you, and you just gave me antibiotics.
Yeah, exactly. Which is, it's another story. It's horrible, right? Because it completely screws the immune system. But yeah. So the chain is you measure something, you identify, then you treat, then you maintain, right? Or you stop treating because there's no more problem. And the other thing that's more for the clinician. For us, for me, I wanted to build something which was simple, right? It's simple, this financing through assets. You bring one asset. We had actually two or three devices at a time. We built a pilot. We tried it in 5 clinics. So it's simple, right? You give an asset. It's a monthly payment. We tried. People pay or people don't pay. We're connecting these devices with a system to make sure that we can turn them off if people don't pay and then pick them up. That's literally that was the early days. And obviously over time, we added the other pieces of the business as we went.
So it immediately reminds me of one of the clients that we worked with in Tanzania, where, there's certain similarities from a business model perspective for just completely different industries. So they're in agriculture. And so they're building for these agri merchants, so obviously small businesses, supplying these inputs to smallholder farmers in order to, whether it's fertilizer or equipment, etc., to be able to run these farms. And they were building this, essentially, it's a business management software. So it's like, how is it that you can manage your inventory and manage your stock? But it's also was plugged into like SMSs, and it was the technology was like right for the market, but their adoption was very low. And we had a pretty like honest conversations, like, because they're busy investing more money in their technology, but their customer growth wasn't expanding quickly. And we just had a real conversation. It's like, you're actually a supply chain company, right? And it's like the technology enablement's there. So the point is, what is it practically that they need? Is they need a broader range of products, more like to come to them faster at more affordable prices. So you need to invest in your logistics capability, not your technology right now. And so with that shift in terms of what they were able to do, it also allowed them to be able to aggregate the produce coming from the smallholder farmers to the merchants, so they can now access the off-taker market. So now there's 2 revenue streams that are coming from an increase in just one capability around their logistics. And that stickiness on the inflow and the outflow for the agri-merchant now justified the platform and made that way stickier without even actually investing further in the technology. They did that capability accordingly. And the result is they're coming up to, by the end of the year, they're forecasting 500% growth compared to last year, just because that shift in priorities and bringing it back simply to what is it practically that this person needs, and then how is it that we can make it a more integrated solution to address those needs instead of the other way around. How do we get them to the technology and then meet their needs through the technology? They did it the other way around, and they saw the results. And I see the similar story happening in your business as well.
No, absolutely. And look, I really believe that this continent needs. It's the technology is a piece of it, right? But I don't think technology is the panacea. Definitely not in healthcare. It's a universal panacea and solves all the problems. This continent doesn't have infrastructure, proper infrastructure. They have broken infrastructure. There is infrastructure there, but it's broken. So, I remember I built and run a fund, a venture capital firm before starting Ilara, and our theory was technology-enabled infrastructure. Right? So you actually have a business which has some infrastructure, you place technology on top of it, and you make that business run better, more efficient. And so that's what, when this continent is made of entrepreneurs, right? Most of the people here living in the outskirts, they don't have a job. Only 20% of Kenyans are employed, right? But there's not.
Only 20% are employed.
Employed in a formal economy. Only 20%. Those are the people, by the way, who pay the national health insurance, right? It's only 20%. But they're not unemployed per se, right? They don't sit in the streets not doing anything. They work. They sell something. They have a small shop. Everyone, they hustle, right? So they're entrepreneurs, but they have no access to financing. They have no bank account. They have nothing. That's why the fintech models work, right? Because these people need to take payments, make payments. They need microcredits. They need assets. They need a productive piece of equipment to make something, right? So that's what works. I mean, example, goes back to your example in Tanzania, right? You have system by themselves don't solve the problem. Very few SaaS models really work in Africa, and definitely at this level of business, which is kind of mid to low income individuals.
Yeah. So it makes me think a lot as I have no idea the validity of this, but it's just, I'm going to coin a new term called infrastructure as a service, the ultimate African solution. No one quote me on that, because I'm not the right person to take that forward. But the truth is that if infrastructure isn't being provided by the public entities, then it's the private ones that kind of need to do that, because once you're able to establish just these nodes of infrastructure and connection towards these people that are already behaving entrepreneurially, that you're able to unlock a whole economic segment. But before I go down this macro / philosophical theme, let's bring it back. Let's bring it back to Ilara. So you've really painted the picture of how the business has evolved, how the product offering has evolved. We spoke about the vision and like how that has also changed and evolved over time, but you kept it simple, straightforward in the beginning. So I think this is really what I want to know is, where was product market fit in your business? How did you define that? Especially when, the product was still like the product's changed with each evolution.
Yeah. So first of all, Ilara itself is not one single business, if we think, right? If I look at the company, I could actually name probably 5-6 different businesses, right? All related to a small clinic, right? So one is diagnostic leasing. The other one is maybe pharmaceutical sales. The other one is a system, like a practice management software. So that's a SaaS per se. And we'll talk more about the product market fit at each of them. Another model is transformation or franchise or infrastructure embellishment of that as we enter with people. And the other model is we take now over the pharmacies of these small clinics to manage them better and then retain payments from the patients and pay back the clinic. So there are multiple models in one. Now, each of them they didn't come all together, right? We started with this diagnostic leasing business, which still makes 50% of our revenue. Each of these business models has or doesn't have a product market fit yet. The diagnostic device, we found the product market fit fairly quickly. We built a pilot. We placed 1 or 2 devices there. I still remember early 2019, there were 5 clinics. We placed the devices. We started to measure how many tests do they do a month. Are they making enough money out of these tests? More than the leasing fee. We kind of model the leasing fee based on whatever these people are making to make sure that they can pay us, right? And that's how we came up with this kind of model where we said, like, it's 2 to 3 years payments, or if the asset loan is worth, let's say, $4,000 or $5,000, they will pay us $200 per month over 2 years or 2.5 years, and we kind of get there, right? That's where the product market fit were defined by the capacity of these clinics to make revenue based on diagnostics and pay us back. Then there were the other pieces of the other bricks that were added over time.
Sorry, before I just clicked for me before you continue. I think the most interesting point there was when you identify something that's so needed within an environment, your product market fit actually came around from a pricing model. It wasn't like, because the product was there, just the demand supply, just the basic economics was there. But it was with the pricing model is that needed to be defined. And once that worked, then that's when growth happened off the end of it. And I think that's just a fascinating reflection.
Well, it's also funny, demand and supply, because there is the need. I think, and we can get into another philosophical discussion. I don't believe there's so many needs in the world, but not all the needs can be financially viable, right? There's need for trash collection in Nairobi, right? But there is no public trash collection because no one pays for it, right? but there's a need, right? But very difficult to make money out of it. Anyways, so finally, demand and supply. If there is demand, then people pay. So we look at payments as a if you want, as a reflection whether or not there is a demand, and if that demand can be paid for. And supply, there's no one supplying that at that moment in time either, because it's a very difficult market, very fragmented. There's a lot of diagnostics suppliers and financiers at a hospital level, right? But not at a small primary care level.
Well, I mean, that's also like the distribution problem of when you have this equipment that's sitting in the $4,000 or $5,000 per unit, but also if you're looking at the supply or the manufacturer of that equipment that's making thousands of units, it's like the capability to develop their own financing and small sales of one per customer at a time. That's just not their business and their business model. And it's not even I think there's also a huge space in anything that requires infrastructure, like I said earlier, but anything access to equipment and technology and to service is just this distribution layer. Is that can you essentially take on the financial management of going to smaller clients and changing the pricing model instead of per unit, it's over time.
Absolutely. And look, finally, manufacturers are not built. They don't have the capacity to distribute or to lease, right? It's that there are companies which buy equipment from a manufacturer and then finance the equipment or lease the equipment in all the industries, right? In the car industry, in the Uber industry, etc. And then, but the other pieces of the business which came later on got market fit later. Some of them don't have yet a perfect market fit. If you look at technology, right, we charge $8 per month for the platform, and we give 3 months for free, etc. We've spent probably close to $1 million today by now over the past 4.5 years on the tech. Is that profitable? Is there a product market fit? It's debatable, right? There's a need. I mean, it's great. It helps. The platform helps the clinician to better run that clinic, right? The business, also to manage patients. But do they pay for it? Not really. Were we able to build a business today without having this backbone? Very difficult, right? Because we use the technology to see what's happening inside a clinic. We have a lot of data. We have half a million patients now going through our system. So we know exactly when, if someone says, I want to invest, I want to give you money or invest in a certain disease area, we know where are these people. We know how many are they. We know who are they. We know where they sit, etc. Right? So we can measure impact. So I'm not sure if the technology has a product market fit today. Pharmaceuticals, very difficult business, right? We focus now on supplying pharmaceuticals only to the clinics, pharmacies, where we're present with more than just the devices. So we take over the pharmacy and we run it. So kind of like our own clinics or our own pharmacies. We only supply pharmaceuticals to these guys because pharmaceuticals is a very, very fragmented, very competitive business, super, super low margin unless you buy directly from manufacturers. So the pharmaceutical supply chain did not have for us a product market fit. So I mean, it's about you need product market fit for at least one important piece of the business, which makes the revenue, and then we can try other things, and then you keep them or you divest if they don't work.
So my thoughts on that, and again, this is why I love to ask this question every episode, because product market fit is naturally quite an abstract concept and looks different every time because it's also depending on what the need is. Because everything that you've described there as well, it's the same market, right? I think the point is if you're looking at the different products, those are meeting, or the different offerings meeting different needs. But collectively, there's a second order need that they're all meeting together, that if you had to remove one piece, then it's not actually fulfilling the need. And the point there is like, how is it that I'm able to manage my clinic more efficiently and cost effectively, right? And that's very second order in terms of what's there. And again, my opinion to your point is like with the value of the software and the technology is there very much so, and there's a lot of data that you're able to access. But that plus the pharmaceuticals, plus the equipment leasing, plus the other things that I'm missing because it's I'm still trying to keep up with the complexities of your business. It's all an integrated solution. Yeah. I'm just fascinated by how, again, that need evolves, because you can't do, again, it's another thing you can't really do the other way around. So you build those pieces, the point that you integrate them onto a full solution.
Yeah, I often give this example of, you have a house, right? And then you build a foundation and you add brick by brick. You add the first floor, the second floor, etc. And then eventually you have the house, right? And in our case, we didn't build a house per se, right? Because we entered existing broken houses, right? With the goal of identifying the best house in the neighborhood that we can take over and then help the owner of the house refurbish the house, right? So we enter through the door, through the window, through the chimney with different solutions, and eventually we find out the best houses, and then we take them over, we refurbish them, we put a name, etc.
I've got the joke coming to my mind now, where I never thought the African Father Christmas coming through the chimney would be Romanian. But I guess checks out.
Yeah. It's funny enough, talking about this business model, actually, it's not something new. Maybe no one does it in Kenya or or at that level of care in Africa, but you see other models very, very similar. So I actually met a company in Johannesburg. Actually, they kind of very similar business model with houses, right? They go and refurbish or small shacks in Midrand, actually in Tembisa, in between Joburg and Pretoria, and they transform them. They brand them, so they become like a really cool place for young people to live. Like they have a room or a small apartment, but same model, right? Where they don't buy the property, they don't give cash to the owner, they give them assets, they give them building materials, etc., and they get payments over time. So this model exists in different shapes and forms in different industries, and it works.
Fascinating. So you were also mentioning that there's still different layers in terms of, because I think obviously the nature of this, and when you're talking product market fit, you'll have a certain part of the market that's on one solution, a certain part that's on the other. And I think a big part of that is it shows there's a lot of room to grow with your existing client base, but still so many people to really bring into this pyramid. I just want to get a sense of where the business is at now, right? Also just one thing for the audience is that earlier on this year, you raised a $4.2 million round of funding, which is, I guess, congratulations. Now a good 8 months down the road since you acquired that. So scale's really been achieved by you. What are the numbers? You're sitting on 700 to 1,000 clinics on your books?
Yeah, so we have 700 clinics, kind of, let's call them the deal flow, right? Out of which to which we give a diagnostic device or something else, right? And then they pay us, maybe $200 per month, and we have, as we go at the top, we have 15 clinics where we take the pharmacy over and we run it, so we have a significant more revenue for the clinic, and it's a revenue or profit share rather, right? So there's the model. Our goal is actually to increase the top of the pyramid and enlarge it by picking up more clinics from this base, kind of like a private equity or venture capital model, right? Where you invest in a bunch of people and then you identify the best ones, you top up, and then eventually you build your portfolio, right? So that's in terms of numbers. Again, the revenue is not crazy, right? We grow steadily. It's a market where, because of such a small payment per head per individuals in healthcare, you need to be very wide. That's why we need to be in so many clinics. That's why we need to cover so many patients, because each individual piece is too small in itself to make a business. So the goal, we continue doing that. We continue picking more and then enlarging this top of the pyramid to really get to this end goal, which is having this network, right, of Ilara Health branded clinics, us running the pharmacy as well, which will be the proof. The brand is a proof of the quality of the care delivery in the clinic. Because once we are in, more than with a device, we actually can afford to train the clinician. And as I mentioned earlier, right, the biggest problem is actually quality, right? These people who run the clinic, they're not trained properly. They're barely trained in, performing a consultation, but they don't know how to run a business. They have no finance background. They have nothing. They don't know how to buy. They don't know how to run a pharmacy properly. So that's what we bring, right? And eventually it's going to become a network.
So, the view from my side, and obviously correct me as I'm saying this, but there's two sides to the business that I see it. Is the you as the supplier, the service provider, and then you as essentially the private equity and owner at the same time. And the view that I see from that, at least at this point, and this will probably potentially change in time, but the one's providing you scale and the other one's now unlocking profitability. And was that also again the view and the strategy from the get-go, or is this again the more the private equity ownership play? Is this just something that's evolved over time with your thinking?
Well, I think we need both, because we can't. I mean, if our goal is to have this network of clinics, right, at the top, branded by Ilara, we couldn't have picked them from something if we didn't have this base. So we need to keep and enlarge the base and nurture the base. It's like a deal flow. Learn who is the best, because in one neighborhood you may have 20 clinics, right? We may work with 10 of them. We need one, right? That one, the best one. Well, how do I identify the best clinician entrepreneur? And if you go back to what does it mean the best, right? People are number one. Clinicians. These businesses are they have one owner and maybe one or two employees, right? That clinician, that entrepreneur is like the founder of a startup. That's the most important piece of the business. Okay, the position of the clinics in the street, the number of patients they have today, how long they've been around. But finally, it's just about the entrepreneur. If that entrepreneur is amazing, then they will build they build already a good business. They may not have access to financing, they may not have access to knowledge, but if you're on the structure of the person, that's the most important, and it's very difficult to identify, right? Because finally, it's a mix of numbers and psychology, right? And that's why it takes a lot of time for us and we need this deal flow, because only 10% or 5% of these many entrepreneurs is worth supporting eventually to become at the top.
Awesome. Okay, so thank you for all these shares and the different avenues that we've gone down on this. It's been a really fascinating conversation. I think I could go forever, because now it's sparking my curiosity just around healthcare, but also entrepreneurship and the view of the importance of how you explain what your company is and what the value is so critical depending on the audience, because the way that you explained it now is your strategy around how you're going to grow into this really profitable company is very, you try to explain that to a clinician, they're like, I don't really care. But explaining it to an investor or explaining it to a board or having your own vision is like, these are very different narratives that you need for different people in order for this to be executed. And that I just find fascinating, because it's how multifaceted one business is, but also, again, too, I love how complex yours is, but how simple it is in your mind and how easily you're able to articulate it from different angles. So again, just congratulations to you and what you've been able to build, and how simply you're able to explain something that's truly one of the most complex businesses that I've come across on this podcast to date. So well done. I think, Emilian, now I want to change gears into the whole point of scaling. So I've brought up the topic of complexity now, and you've mentioned now people and getting the right entrepreneurs. So there's a whole trust element involved. And just to give the audience context, it's like what we spoke about offline is how much I personally care about the topic of freedom for entrepreneurs. And it's like, how can we achieve a meaningful state of freedom in our lives when we're really doing what we want with our time and our money? And Emilian has gotten to that point in many ways, where you're flying over the world, you're building a second business, and you're doing this, when you've already scaled Ilara to a point, but you're still very much on that like upward curve, and there's still so much scale to be achieved. And yeah, so I just before even going into the subtopics, I just really want to understand, you're just how you got there and what life is like having this level of autonomy.
Yeah, I wouldn't envy. And I think a lot of people think, well, entrepreneurs is cool. You work from wherever you want. You do. It's not that, right? We, sometimes my wife is telling me, Ruud, you chose your life. Don't complain anymore, right? Because sometimes I'm like, I have friends that have, jobs from 9 to 5. They make way more money than I do, and are they happy? I don't know, but. So it's a difficult choice, right? It's a difficult choice because there are a lot of uncertainties. You run a business, you never know if this business is going to succeed. You put all your energy, all your savings, everything you have. You obviously it takes a toll on your health, on your family, on your friends, on your life, on your time. So it's a tough one. It's a tough choice, right? But I think everything comes from belief and motivation and goal. And what makes me, wake up in the morning is my goal in life of helping people live healthier and longer lives. And that's very personal. I had, significant health issues, 10 years ago, and over time, because I completely screwed up my health by, working like a maniac and traveling and not eating properly, not moving, not taking care of myself, and this, and plus I have friends. I'm 50 now. I have friends who started to actually have problems. Some of them passed away because of heart attacks and other problems, right? Cancers, family members. So I made a goal, an obsession rather, to help people around me, myself included, and people who want to get help, to live healthier and obviously eventually longer. And now the question is how to transform this goal in life into something which can also sustain financially. So that's how Ilara Health came, with this goal of bringing access to better quality of care and diagnostics first in a world where people do not have access to this. And that's how also my own longevity or health optimization clinics came, or I can do the same thing for people who can afford, and I can go deeper into that. But everything is around this, right? But very, very important is a life of entrepreneur is not healthy. And I have so many friends who tell me the same story. We worked like maniacs for 5, 6, 10 years. We screwed up our health. Now we try to fix it, right? And some of friends of mine whom I help on, with my longevity clinics in Cape Town, I see this problem coming over and over again. And I'm not sure it's right? Because on one side you spend so many years by breaking yourself, and then you try to fix it. Sometimes it's possible, right? It's never really too late, but there's always something. You can't fix everything. So it's so important for entrepreneurs, and maybe it's easier to theoretically than practically, but it's so important to take care of our health, mental, physical, emotional health, right? Having people around you to support you. Luckily, I have a family who supports me. I have friends. I take care of my health, but I didn't do it earlier in my life. So it's very, very, very important, because when I see people failing because they work themselves to death, and I don't think that's bad. That's good for themselves. It's not good for the investors. It's not good for anyone. It's a very fine line, right? It's difficult because we need to work nonstop, right? But how? At least in my case, I've been trying, past 5, 6, 7 years to find this balance where I can take care of my own health. It helps me actually making better decisions. It helps me working faster. So it's not about the length, but it's about the right decisions to make. And this helps everyone around me, myself, the business, my family, my friends, everyone.
I also love the way that you answer that question, because when it came down to essentially your own freedom and autonomy, where it starts off with is again, I'm going to take this on a bit of a detour, but the intrinsic motivation. So intrinsic motivation consists of purpose, mastery, and autonomy. So purpose is, do I believe that I have a purpose and what I'm doing is making a contribution to people that I care about, or something that I care about that's bigger than myself? Autonomy is, am I able to do I have control over how I spend my time and how I go about living that purpose? And then mastery is, do I feel like there's a continuous level of challenge and improvement in how I am developing in living that purpose? And for you, even though I asked the autonomy question, you answered this on an intrinsic motivation answer. Because the point for there, what I see so much in what you've said is quite a significant shift in not just mindset, but also values and purpose. Because you suffered from this problem about your own health, you being very career oriented, and again, for the audience, it's like your background was in management consulting, in advertising, so you were living in one of those careers where working 9 to 5 minus the travel, but also making more money than most entrepreneurs make, and changing that and then risking your health was kind of this wake up call. But I think a big part of that is the realization, and if I'm reading between the lines, is that I'm not willing to sacrifice my health and well-being in order for the growth of this business. And naturally, the consequence of that in terms of that mindset is how is it that you prioritize yourself, your health, and your loved ones and whilst running the business. And then naturally what happens afterwards is you now have this freedom to be able to do both. And that came from just what is a mindset of what is more important to me to begin with. And it's very easy to explain this through 2020 vision and hindsight. But if I'm reading between that, it seems like the biggest shift for you was just the mindset of what's important.
No, 100%. Mindset is super important. Look, it's not an easy thing, right? I mean, I didn't change suddenly, and I didn't change a long time ago. It's been a continuous change. Even today, I need to fly left and right, which is not very healthy. And I can't say that I own completely my time. I still don't, right? Because I need to be sometimes. I sometimes need to be here in Nairobi for investor meetings. I sometimes need to be somewhere else for other things. I need to, whether or not I want. So I wish I was. I dream of the moment, of the day where I can 100% take ownership and say, look, I do what I want, but I can't even now. I'm much better than it was a couple of years ago, right? So I think mindset is important. Finally, very often we say we don't have time, right? Well, it's about priority, right? So you prioritize something versus something else. You don't have time for a family because you have business. Well, but then business is more important than family, right? But I think it's easy to say, we do whatever we want. We can be wherever we want. It's not really that. When you run operating businesses, you need to be on the ground, at least, or you need to have an amazing team who executes on the ground. And in a startup world where that venture is not yet profitable or is still not there, is not that obvious, right? So I'm not I'm not yet there. I hope. My mind is there, right? I made my decisions. I know what I want, but I still need to compromise on things until I get there.
And that's actually why I really wanted to talk about this, is because it's also a wake up call to me at certain points, whether it's exercise or spending more time outside or spending more time with friends, and then I'll take 2 weeks to reply to a WhatsApp message, and it's like, sorry, I'm just so busy and occupied. It's a prioritization thing. I'm allowing my business to be more important, and I'm no different than almost every other entrepreneur out there. But it's just a good reminder to if you this level of freedom that I think we aspire to, and we're talking about in quite an abstract sense, is very, still it requires a lot of work to be able to get there. But it's still accessible and attainable now. And to your points around being in startup mode in the operations, there is a requirement that's needed for you to be there. But this is why with the clients that we work with, they're between this 20 to 50 person mark. Once you get to the 50 to 150 person mark, that's when you start requiring leaders in your business that can really take accountability over the profit and loss and required to make strategic decision making. Getting them in place and putting that together, that's a whole different ballgame. But once that's there, then you're able to start thinking about, okay, how do I shift roles as an executive within this company, where I can start either being chairman or, again, being an executive director. And then that's when, freedom is truly accessible without having to exit a company. And then when you're less than 20, you're having to be in the operations, wear 7 hats, be finance, marketing, sales, everything that's required of you as a founder and entrepreneur. It's this middle point and this access where between 20 and 50 people, when you're really putting together your proper management team, your management layers and structures for the first time, that without being able to do that with clarity, without having the right people to trust, without knowing what it is you're going to be prioritizing, you can slide backwards in terms of your time, your freedom, and your health, because the only other alternative that you have is to actually just work harder. Right. And so in that period, that's such a critical journey in entrepreneurship. And this is where Medevol specifically works in, is when you're at this point of putting this management layer together for the first time, it's not about growth. It's now more about how is it that you can have the peace of mind that the people around you can execute on the strategies so that you can be freed up to focus on growth and what you want to do with your time, instead of sitting there worrying that is my core business that I built at this point being taken care of. And it's not just around that for me is the difference between, hey, this freedom concept is easier said than done, right? It's once you're able to have that peace of mind that your team can execute, that's when it's there. And from my understanding, you've been able to build that team around you.
It goes back to people, right? Finally, you need to find the people whom you trust and who can execute even better than you, right? And then you have the peace of mind that the vision that you have as a founder is carried on and executed towards the right direction. And sometimes some of your co-founders or your management team may have even a better way of executing than yourself, right? So, but it goes back to, I think it's size, but it's also people. And maybe with size, obviously you have more revenue, so you can find better people. But people is really the quality of individuals. And I think that's that's the theory. Now, obviously, there's all this debate lately that you may read on LinkedIn around kind of like a Steve Jobs kind of way of running the companies, and now YC is debating around kind of the Elon Musk way. It's like you still, irrespective of the size of the company, you as a founder are still super involved in everything. Maybe not micromanaging, but super involved in a lot of decisions and even executing, right? So versus kind of the theory of management where you actually find the right people and empower them to make decisions and run different processes. So I think this goes back also to it's the quality of people you have and is what you as a founder, what's your style, right? Some people are extremely micromanagers, and I've met them. So, I met people who actually, despite respective of the size of the teams, they still want to do everything and be involved in every single call and every single meeting, which is, I don't know. I'm not debating whether or not that's good or not. But it's founder mindset and it's quality of the team, which allows eventually that founder to maybe not step aside, but focus on things which can make the founder even making better decision. And I still remember from our the fund that I built and used to run for 4 years, and we invested in a bunch of companies in South Africa, by the way. And our one of them was Get Smarter, the edtech company, which exited eventually. And I still remember our theory was founders, that had 2 founders, you guys need to take 20% of your time, free time to be able to think, travel around the world, go to conferences, and eventually meet your acquirers. And it worked. This strategy worked really well. So they removed themselves from the day-to-day, or they're still running processes, but they hired better people with investment of the fund. And then they eventually went and found their buyer at a conference in the US. And they've got the complete freedom afterwards.
Yeah, and so, but to that, I think also, this is where my bias is I've got at least in my lifetime now, is the intention is not to exit. I'm not building a business to exit. This is for as long as I can see right now, this is my sense of purpose and contribution. Like, what I care about is helping entrepreneurs build great sustainable businesses. Like, my vision is, imagine a world where just 10% more SMEs were able to be sustainable without being dependent on the founders that built it. What would that do for the economy? What would that do for mental health? What would that do for wealth creation and job security and work-life balance and being a good parent? Like, this is our little ripple effect about how we're going to save the world. And so this is something I'm going to keep caring about forever. Also add that I also have the belief it takes 15 to 20 years to build a really great business. And my bias comes from the fact that one of my business partners is a self-made multi-billionaire, and he's 83, so he's done that like more than once. And so I caveat that to the point where I fully agree with everything you're saying, and I find this. I've seen the same arguments happening online between founder mode versus manager mode, right? And I see that as it's too reductive, because it's the same point as like when people break down complex realities about life and try to break it down into here's a black and a white one versus zero. It's not that simple. There's the gray area. And I think the point is, like, the way that I've at least explained it in my head is that every business still needs a very powerful entrepreneurial spirit to come up with innovation, to drive action quite quickly, to be decisive, make decisions, spot opportunities, see value, and be a creative force within that organization. The problem with people that are professional managers is that they're not just not equipped and trained, but they don't have the personality for that. They're literally, their personality types of people are more to, how does I take something, optimize the hell out of it, make sure that it's really structured, systematized, and smooth. But I'm not wired naturally to go out and be and break things and be innovative and creative and spot an opportunity. And so I think the problem is that when we go through a business and especially when a founder exits, and that doesn't necessarily mean exiting from the cap table, they could just check out, right, and move on to something else. It means that there's now a void of the entrepreneurial spirit. So this school of thought around founder mode, etc., is that it's not as straightforward as just founder, but it's more just around how is it that we maintain an entrepreneurial spirit, not just within the culture, but within the leadership team of this business, to ensure that we're not losing the sense of innovation, creativity, and opportunity seeking that any business needs to be able to grow. And again, even the way I'm saying that is okay, cool, it's that simple. But the other reality is then also no one knows the business as well as the founder, and it's very complex, right? So, but the reality is, I think any leadership team that needs to be really complementary is you need all of the above. You need someone who's pushing for results. You need someone who's pushing the boundaries for new opportunities. You need someone who's taking care of admin, that's trying to integrate all of these people and being stop throwing ideas at me. Can we just execute the past 4 that you gave me and make sure that can happen? But then also critically, you need empathy. You need people that can integrate this with human beings. And how is it that we can develop empathy within our leadership team, management team, and structure and culture to make sure that we are putting together not just this innovation and idea for entrepreneurship and driving results and putting in systems, but making sure that we're able to bring a human element to it as well. And if we can develop a leadership team that does that, then I think you've got something that's really, really, truly powerful.
100%. You need this balance, actually. It's very important. So, as you said, I think founders are creative, but also founders may try to do too many things, right? So, we have a lot of inspiration.
It's the consequence of creativity.
Exactly. But you need a management team or co-founders who may be different than you, right? Who are more into the reality. You can't do that. You can't do everything, right? So this balance is very important, either within the team between the different co-founders, or between, if you're a sole founder, between you and your management team, or if you don't have a management team, then you need help from someone else. And that's why the concept of helping entrepreneurs, mentoring, is great, right? Because you need this balance. Because otherwise, this is a big chance that the venture is not successful because the founder tries to do too many things.
Mm. And on that is the ultimate simplicity that I got from Nick. He's got a name. I keep saying it's my other business partner, Nick. Is there's just 4 simple things that make any great business: is having an impeccable track record, a strong complementary management team that knows where they're going and how they're going to get there. That's it, right? I feel that's the simplicity on the other side of it, is that if you have that, then you've got a great business. But now on the topic of and again, Emilian, I just want to comment on how much I'm enjoying the conversation, because we're able to go up to these level of principles and talk about this. But the whole point of what I'm also trying to do for our audience is make it practical. So to make it practical back to your team, right? One, how is it that how did you put your team together in the first place? But also, how is it that you've been able to develop so much trust in them that you can be able to fly around the world and know something as complex as the business that you built is still being taken care of? How did you manage to actually do that?
Look, I don't think that there is a mathematical approach or solution to finding, first of all, co-founders, right? How do you find your team? If you want to, I don't want to build a business and run a business by myself. I just hate. I would be so sad and so lonely. So how do you find your co-founders? Well, some people find their co-founders within YC or other, venture builders or incubators, right? In my case, there hasn't been a kind of a mathematical approach. Just met people in my life at the right time, and then my co-founders in Ilara, it was very one of them just fell me, met in London through an introduction and joined, which is an amazing choice. The other was more a hire in the beginning, but also introduction. So it's introduction, it's people who know people, right? You are on LinkedIn, you are connected, people who introduce you to other people who know what you're doing and can call and say, hey, I have this guy or this girl sitting somewhere. That would be a great match. Same in my clinics, in Expand Health clinics, met my co-founders through someone who I met at a certain moment in time in Kenya. And then it's just I don't know. It's a mix of, I start to believe in this kind of surrender experiment. I don't know if you've read a book like the surrender experiment theory, where the things happen, right? Things happen because they're meant to happen, and but I think it's a mix of being being intentional, but also letting things to happen. You need a base, which in finding the team is a network.
Sorry, Emilian, I didn't know when to time that, and I feel like I jumped over you. But the point of what you're talking about, surrender, is close enough to this. The reason why I lifted up my sleeve and showed you this tattoo on my arm means serendipity, right? So at least it does to me. Like it could, I found it on like page 6 of Google Images, so it could mean anything. But for me, it means serendipity. And the reason why I pulled that out as soon as you said that is, for me, what it means is, whenever I'm very intentional, but not trying too hard about the outcomes that I'm getting, usually that level of openness is when I have the best meetings, the best introduction, the best outcomes in my life in terms of what's going on. And I think that I love that your recruitment strategy was never about getting a recruiter to get your management team together. It's about the serendipity, about how is it that you met the right people
at the co-founding level, at the management, at your team under you. That's a mix of your own relation, in my case, my own network. And we also recruited people through and we've got some really amazing people through recruitment. But I would say at least in the ventures that I've been involved, I built, was probably 90% personal network, LinkedIn and introductions versus standard recruitment. But also we've got some really great people through the standard recruitment agencies.
When you're putting this team together, I mean, you mentioned co-founder now, and you're talking also about management layer. How, because again, every business is unique, but I just want to hear your story. How did you go about prioritizing which person to bring in? Because now putting it in management levels, like these are expensive hires, right? And they're expensive people to bring within the business. Even if it's not necessarily on salary now, it could also just be in terms of equity that they need to be remunerated. So how did you go around prioritizing what were the first hires that you needed to put in, and what does your management team look like now from a job title perspective?
So I've been always looking for people who are motivated by the cause, right? by what we're building, by what we believe into, and giving younger individuals an amazing platform to grow, which they wouldn't have got in a corporate or somewhere else, right? So, and very often this has been a trade between a higher salary and just a standard career and a significantly lower salary, a salary cut, and an amazing opportunity to work with great people in an amazing place, and then driving the process, driving the company, eventually being, jumping the ranks and getting into the top level of the management team. So money, I don't think money is number one. To find that money doesn't make people happy per se, provided it is this base which covers your kind of like needs and day to day and pays the bills. The rest is really inspiration, working in an amazing team, coming to a place which build companies in Cape Town, big companies in Kenya, great places to be, responsibilities, and really like forming these people, training them to become leaders, to become entrepreneurs, to become founders eventually of their own companies, because one day they may leave and they may do something else for themselves.
Okay, so for this team that you mentioned now your again philosophy and mindset towards how you're taking in people that there's potential in then developing, but that's still now, especially for you as the founder and the CEO, needing to do the developing as well. What I want to know is how you manage that with also the trust and the freedom at the same time. Because practically, I imagine this is like a longer onboarding period. You need to be a little bit more hands-on. There's a bit of closeness, slowly separation. Like how do you actually get the point to when you get someone who's with high potential to the point of trust? How do you get from there to there?
I don't know. Maybe it's just I trust people first, and then and then I kind of give them the benefit of if they disappoint over time, that's a different story. But I first trust other people, and maybe because I met so many people in my life, through recruiting hundreds or thousands of people in my Rocket Internet times in different places in the world where I didn't even speak the language, and hiring so many people. Maybe just it became like, like you did due diligence companies, and then you maybe spend 5-10 minutes on a deck and you kind of get it right, whether or not it's good. Same like people. You speak for, you speak with someone, you go out, you go for a drink, you chat, and then you kind of make your, you understand if that person is good for you or not. And obviously there is not, sometimes I make mistakes, and you also, I kind of like try to put people in a position to be able to learn, to try them and work with them, and instead of just putting them up there immediately. And then over time, I realize whether or not they're the right people I want to work, and also right people from a mindset perspective, because I want to work with people who, I'm happy to work with, right? Make me happy. It's not just about someone who's amazing and super smart, etc., but someone who's easy to work. And they shouldn't be like me. They should be ideally different, so they can challenge me. So one day I can actually, as you said, have more freedom and be able to step aside. And also, we're talking about freedom. So I still don't believe. Whether or not I have my passion. Let's call them my passion projects, right? But they're still in healthcare. They're still in optimization. They're still in diagnostics. They're related. I would not go to them and build. First of all, I don't have time. I have enough to do with Ilara. I have enough to do with my clinics and Expand Health. I would not build something else in another industry. I'm not interested. I'm interested about one single thing, which is health, which is personalized health, which is optimization, data-enabled, data-backed health. That's why I wake up in the morning. That's what I do every day for myself, for people around me. Some of it can be applied to lower income environments where people don't have money to pay for personalized health. There's another part of the world which can pay for this, but it's the same principle. It's one thing.
Yeah, and look, I think that level of focus is crucial to you and your team around what we're going to concentrate on. But it's also the why we're doing this. Like, why does this matter in the first place? And I think what allows you to be able to tell within 5 to 10 minutes whether or not someone's going to be there is because your clarity of purpose and focus is so high that if someone's just not motivated by it, it's like there's no matter how competent you are, no matter how amazing you might be, there's just a certain level and point where it's like this isn't just going to work if you're not on the same page there. But Emilian, what also really sparked a lot of my curiosity about you is that, and what I'm fascinated by, there's so many founders that I've worked with, that I've spoken with, that these topics around control and topics around trust and delegation and all of these things are things where there's still a lot of anxiety around. And for you, the way that you've explained your story, I don't know if it's a chicken or the egg thing. I don't know if you're just a person with naturally low levels of anxiety, which allows you to be able to trust and hand over and make mistakes, or the point of, you really built this to the point where you hired the right people, made the right decisions that then lowered your anxiety afterwards. Because everything you're describing is, it's like, it's not about people having to earn the trust. It's like you trusted them naturally. Like you built them and did this. It's like a lot of this was out of your choice. And so there's just a lot of your mentality comes down to, I'm accountable for my own decisions. I'm the one that's making these choices. I'm allowing other people to have that accountability and handover and trust. And I'm just finding this quite fascinating. So I want to see, it's like, how can I impart a lesson from you and your wisdom onto other people? And just understanding where that low level of anxiety is, when for so many entrepreneurs, like entrepreneurship is anxiety inducing.
Well, it takes a lot of training, right? Because anxiety and stress is there, right? Why? To a certain level, stress is good, right? And anxiety is good, right? When our ancestors were running away from the lion, right? And then it was good, right? It's a bit of stress, you get eaten by the lion, or you survive. You survive is good, right? Because that's low level. Well, that acute stress is actually good for your health. Long term, low grade stress is actually very bad. But as leaving aside a joke, it takes. So one, I'm not concerned if people make mistakes which will not break the company or the bank account, right? So making mistakes is human, provided that I make mistakes, a lot of mistakes all the time. I learn, I try not to make them again. Provided that you make mistakes and you learn from them is great, right? Because it remains, you're not going to, in principle, not going to make the same mistake twice or 3 times. So, so allowing people to make mistakes is good. Anxiety as as a founder and a CEO, it was so much stress around, right? Stress for fundraising, stress for everything, operations, everything. It's just about controlling. I mean, I've been bringing in my routine things which can allow me to control stress and to lower anxiety. I meditate every morning. I sit in front of my red light panel. I walk in the nature when I can. I start my day with 30 minutes fasted walk in the sun. Kind of like puts me in that mode, which is a calm mode of being calm. Doesn't work always. I try not to. I actually try not to read my email and my WhatsApp the very moment when I wake up. I'm not always successful, but that's my goal. Because so my goal is actually, if you put yourself in that state of calm from the beginning of the day, it will stay with you for the rest of the day. So you kind of build a shield, right? You may have things coming and hitting you, right? Stress, problems. But if you remain zen, because of that first half an hour to an hour was an hour of zen, it helps a lot. And I'm trying to have, I'm speaking publicly about this, I'm writing articles, I'm trying to get people around me to do the same. It's not easy because it takes time and a lot of, if you want a lot of, bringing these things in your routine, you need to find the time to do it.
100%. It's something that I've always been driving myself towards for a while, because not just from whether I'm listening to Andrew Huberman's podcast or having conversations with you, or just my own lived experience of what is it like, what is my day-to-day existence like when I do this in the morning. But it's something I'm being a lot more deliberate about, because for me, having my phone next to me is useful because I've got certain apps around sleep trackers that can do that. But my level of impulse control is the lowest in the morning. So opening that up, and like now, for example, I've gone down a path of yesterday deleting Instagram and Reddit off of my phone again. So the moment that I wake up in the morning is I've got no desire to scroll on something that's just dopamine inducing, so activate my brain and help me wake up, because that's what my brain is craving. And so, because also from a motivational perspective, it's like I don't actually want to look at my emails when I'm still waking up. But so I'm removing those temptations. But now, even this morning, is going out into my garden and doing some of these core exercises that I've started engaging to help protect my lower back. And just that, and the state that I've been in throughout the day, compared to last week when it was open up and then go through Instagram and it's like, I should get out of bed now. And it's like, but now I feel brain fog and groggy. And it's like, and it just doesn't start off well. Like, to your point, I've started a day of getting up, there's movement, doing it outside, my barefoot, feet in the grass, like sun directly into my skin and my eyes. And then by the time I wake up, like, then I had a family a phone call with my grandfather whilst I'm busy making breakfast. So there's a certain level of like connection and everything doing there. And this was all just like, the only thing I planned to do was actually get up and exercise. But the rest of it kind of came naturally, because I suddenly felt like I've got more time on my hands when it was practically different compared to any other morning. And that feeling has come throughout the day. I had a realization even before recording this podcast of like, sure, I've still got all these tasks to do. But then I look at my calendar for the rest of the day and I'm like, I'm actually practically not going to be able to get to them for the rest of the afternoon. It's like, I guess I can't get to them. Cool. Let me just handle my afternoon and I'll catch up with it later. And previously there's stress induced with that. So again, I love that. I share my own experiences there just today based on what you've discussed, because it's one of those simple things where it's not necessarily complicated in terms of have to do these things around my business and like the people that I'm with. It's like, it's actually, are you taking care of your own health and well-being? Because that will reduce anxiety and stress and give you more control of your time than actually anything else you could probably do.
Yeah, but it's about habits, right? And it's not easy. Seems easy, but actually it's not easy. It takes a lot of discipline. And what I found in my own daily routine in friends, in patients, in our health optimization clinics, in Expand is that if you start to give people a list of things, you need to wake up at whatever 6 and do that and meditate and do your whatever, walk for in the sun, do your 30 minutes gym, do this and this. It's not going to happen. It's actually one habit after the other. You start with something simple, with like, let's say, move half an hour for half an hour. Do that for a week. I actually put in my calendar. I mean, until I get a habit in my daily routine, I just put in my every morning. I have like quite like 15 minutes of things in my calendar. Like my day is broken in 15 minutes, and I still leave things there, which may not be calls or meetings, but just like I need to do this now until it becomes part of my habit, and then I deleted it. Right. So it's a recurring thing. So meditating was in my calendar for months, and then now I do every day. Walking the same. So it's just one after the other, and you stack up habits, and eventually you get to the point of saying, well, I kind of like I don't have any more space to add things, and then you start to make decisions. Or what is that? How important is that habit for me to be a better person, to be a better entrepreneur, to be a better family, to be a dad, to be a whatever. And then, but it's not easy.
It definitely isn't, but I think it is a lot easier when you've got the right technology with you. I mean, we can pull this full circle back to like diagnostic equipment, but just in terms of health trackers. And I love, again, a story that you shared of, again, offline, that your investor, when you first started, you and your co-founder bought you both Aura rings, because even for them, their mentality was like, you take care of your health, then I know you'll take care of the business. And I just love that from a mentality. So can you just talk me through that story and what that's been able to do for you? Because underpinning everything we've just spoken about is like, where does it go wrong for so many entrepreneurs is that they don't prioritize their health. And as they get more stressed, they just chip away at these habits more and more and more until they've lost all these fundamentals around taking care of their health, and they fall off the rails.
Sure. So, I mean, finally, let's talk about sleep, right? Because for many years, I mean, until not long time ago, right? Well, we're talking about sleep, right? We're working. I still remember my consulting days. We're there until 1 o'clock in the morning. Like, great. We're there 1 o'clock in the morning. We're there the first at 5, whatever, 6, 7 before the partners. Everything was about working hard, not taking breaks, not sleeping, right? But I think there's been this kind of lately in the past, I would say 5, 6, 7 years, this kind of wake up where we realize that sleep is so important, because there's the only moment, there's a moment of the day where actually of the 24 hours where your body recovers, your brain recovers, you make better decisions the next day. I don't know how many times it happened to you that you woke up very early, so you didn't have this REM part of the memory rebuilding part of the sleep, and you forget names, forget things, forget objects. I mean, how many times I fly at super early in the morning, so I wake up at 3:30, go to the airport, and I forget something on the security my phone or my computer. It happened to me, right? So anyway, sleep is very important. And for many years, myself, I still remember I was telling my mom even 10 years ago that I was sleep when I'm going to be dead, right? Dead. I was sleep when I'm going to be dead. And I don't even want to know the damage that I created to myself by sleeping 5 hours a night or less for probably 30 years. Anyways, we'll find out. I hope I'm not going to find out. But story. So one of our investors in Ilara, early stage in 2020, or that's COVID. No, 2020 or 2021. So it's just the beginning of COVID. Said, look, I'm going to invest in you guys. I have these funds, and his theory is that he wants the founders to be healthy, because if the founders are healthy physically and mentally, they're going to make better decisions, so they're going to better run their company. And he said, look, I give you, so the three of us in Ilara, going to give you, Aura rings, and then you'll share the data with me. He had a team, so kind of like through an API. And I was like, come on, what, you want to see my sleep data and you want to track me and track my steps and my whatever activity levels? But actually, believe me or not, this was probably one of the best things that could have happened in my life, because I thought I was sleeping. I was sleeping maybe 6 hours, 7 hours a night. I don't know. I was okay. When I measured my first, I still remember after, because it takes a couple of 2 weeks for the tracker to learn. It was like after 2 weeks, my deep sleep was less than half an hour, and it should be actually about 20% of your total sleep, so probably an hour and a half. My REM was so the morning sleep. So the deep sleep is the first part of the night. Usually happens between 10 and 12, and the deep sleep actually builds your physics, like rebuilds your physical structure of the body, muscles, brain, physical, right? And the REM happens in the beginning of the morning, and this rebuilds your memory, right? And interestingly enough, this goes back to the circadian rhythm, right? When our ancestors were sleeping in dark in dark caves, right? They were going to bed when the sun was going down. They're waking up when the sun was going up, right? So the sleep, I guess, patterns have been built genetically at that moment in time. If you go to bed at 12 at midnight, you're not going to have the same, even if you sleep 8 hours, you're not going to have the same deep sleep to the 1.5 hours, whatever deep sleep. Same it's really alongside this circadian rhythm. So anyways, I thought I was sleeping well, horrible. And I started to understand what impacts my sleep. Obviously, time of going to bed, time of waking up, super important. Eating. Every 10 years, apparently, the theory is that every 10 years we get older, we lose about 1 hour of adaptability for your body to actually digest, for the digestive system to digest the food. Because what happens when you digest, right? Your heart beats. When your heart beats, you can't sleep. If you have more than like 70 beats per minute, you don't sleep, right? So, or the quality of the sleep is horrible. So your deep sleep in the beginning of the night, if you eat at 10 and go to bed at 11, your deep sleep is going to be affected. Obviously, when you're 20, it's okay. When you're 30, it's okay. When you're 50, it's not okay. Alcohol, like drinking a glass of wine, 2 glasses of wine, it's horrible. Same heart rate pushes, and you see your quality of sleep. Your heart rate is super high. Your heart rate variability is super low for 4 hours in the night, and then starts by 3 in the morning. You start to recover. Anyway, so data, right? Data is so important, and you start to learn how to manage, how to improve your sleep. It's not about the length. Length is important, but it's about the quality. How much is deep? How much is REM? That's the most important. And then you can biohack out, you can try different things also. But again, sleep is extremely important for everything else. It's important for your health, but it's important for your decisions. Like some people can say, oh, I don't care. I don't care. I don't want to live until whatever. I'm happy to let you go and then push it to the end, not sleep. But that's going to affect your next day. I think there's a study showing that if people haven't slept for 24 hours, it's like equivalent of drinking, I don't know, 1 bottle, 2 bottles of wine. It's just so bad, right?
Yeah.
So anyway, investment into people. So belief. This goes back to the belief that sleep improvement is so important for founders, for decisions made by founders to better build and run their companies.
I couldn't agree more.
Aggression, the lack of sleep. How many times, you didn't sleep and then you were aggressive?
Yeah, 100%. I also want to, but what happened to you before and afterwards? Because, I mean, you as a founder, you had these behaviors that you'd had for so many years, thought that you were fine, suddenly got this Oura ring and got this data, changed your behavior. What did you notice in yourself? What changed for you as a person, as a dad, as a founder, as a leader? What was the outcome?
So I thought that was okay. It's like, people who drink a lot, and I love my wine. But that's like, you don't realize, right? When I was in South Africa, I was drinking maybe 3 glasses of wine every day, right? I didn't feel it. I was okay. But then when you stop or when you lower your consumption of something, wow, I feel better. Same like sleep, right? I thought I was okay, but then when I started to improve my sleep, I realized I'm a better person. I'm not getting angry against the waiter at the restaurant and against I don't know who, the driver, the Uber driver. I'm not aggressive anymore, or way less. I'm a better person. I make better decisions. I remember things. I remember that the birthday, I don't know who, versus forgetting. I have way more energy. Way more. I don't need to drag myself out of the bed in the morning. Bam! I don't even need my wake up. My alarm in the morning. I wake up I wake up at 6:30 and I wake up with full of energy, right? So and behind the scene is chemical. Yeah, your cortisol levels are right, are high in the morning, the way they should be. Your hormone balance optimizes, my thyroid went well better, my testosterone went up. So it's a lot of things that you can explain after. I feel better. I feel better as a human, much more energetic. But behind the scenes, you see the chemical reaction and what's happening in your body because you sleep better and because you optimize the sleep, much better quality, and explains everything else.
Yeah, no, it's you. So I've got a Garmin Phoenix 5S, I think it is. It's a couple of years old. But I'm and my partner, she's getting a ring as well, but a competitor Aura. They're getting she's out the Ultra Human. It's definitely motivated to take the measurements up to another level because it's when I've noticed when I'm on holiday, for example, and I'm able and like naturally I don't go to bed ridiculously late. I don't drink a lot, but my sleep. I feel like I'm like that. That's the biggest thing. Is like it's got nothing to do with me like going somewhere else, right? I think that's a new level of novelty. But the fact that I'm able to get rid of sleep debt and develop a consistency in terms of sleep, my feeling of vitality each day, I feel so much more relaxed. Everything's better, and sleep is crucial, and I'm definitely something on top of that.
Absolutely. And, it's interesting because at a certain moment in time, you may not need trackers anymore. It's great to have an Oura Ring or a Garmin or something else until you learn what helps. And then afterwards, I still wear my Oura Ring, but the reality, I kind of know today. And I sometimes, you make your own decisions, right? You make a decision to go out and have a late dinner with friends because that's also important, right? Mental happiness and society, and then it's important, right? But at least you made your own choice. You have a glass of wine if you want. You made your choice, right? I know it's going to affect my sleep, but I may want to make the choice. So
yeah, and it's also that trade-off because at that point, it's when we get too obsessive over what we're trying to do, then it also becomes counterproductive at the same time. But also, it allows for a lot more intentionality. It's like I know. I'm exchanging my sleep for this, but I also know the fact that I'm never going to have these opportunities to really connect with my friends that are in town for like the first time in like 2 years. I'm screw my sleep. Like this is something that's more important to me right now. Emilian, I think just to end off there in terms of a topic of priorities, it's been a fascinating conversation hearing about your story, your journey of scaling this business, just how you think as an entrepreneur, how you think about health. I think that's been something really epic to chat about. It's something that I'd probably want to chat more podcasts about. Probably we could just talk about sleep for like 2 hours, for example. But and this is all we've really got for today and this conversation. I think there'll be many more in the future. But I think just to end it off, my last thing that I really want to know is what does the next 6 to 12 months look like for Emilian, for Ilara Health, for Expand Health?
Yeah, it's really, it's succeeding. Is continuing growing Ilara and also just need for funding. I'm in the middle of a fundraising round for Expand. We have a clinic in Cape Town. We have another one in Romania. Keep building these clinics. We just launched the second clinic. Keep making an impact. Keep saving people. And for myself, bringing more resilience in to help me do what I do. Because the reality I have a stressful life, and there's a lot of outside stress elements which hit me from left to right, and from up to down. And I can't stop doing that, right? I'm building companies, I have a family, I have friends, I have a lot of things around me, and I know that a lot of these things are not very healthy, but I can't stop, right? And then the question is, how do I build that shield? How do I build that resilience to help me do what I do without all these things taking a massive toll on my health? And resilience means physical resilience, means mental, means a lot of supplementation and things, and keep myself healthy to be able to succeed. Because what I do in my professional life is actually my personal life. They're intermixed, and everything is about health optimization. So that's the next 6 months, the next 12 months, and probably the foreseeable future. I don't see a change in my trajectory anytime soon.
Awesome. Well, I hope there isn't, except for the fact that it just keeps getting better as you learn more and develop new skills, new networks, new technology. I'm excited to I'm excited to keep following the journey. Emilian, finally, what's the one question that I haven't asked you that I should have asked you that you'd like to answer now?
One question that you should have asked me. I don't know. I think you asked me. Yeah, why I do what I do. I don't know. Seriously, I think you've asked all the questions.
Okay, well, awesome. I'm happy to know that I ticked all the boxes in the conversation. So, Emilian, thank you for being on the podcast. Thank you for sharing your story, and hopefully this has inspired some people in the audience to take a little bit more care of their health and well-being. Thank you very much.
Thanks a lot, Cameron.
I really loved this conversation with Emilian because there were so many topics here that are so dear to my heart. Whether we're talking about physical well-being, psychological well-being, we're talking about the well-being of our businesses, just the nature of being an entrepreneur. This is everything that matters so much to me, and it's exactly why I do what I do with the MedEvolve, is to ensure that as many entrepreneurs as possible can take a holiday where they actually switch off and their business keeps growing. And the reason why is, how can we have this greater level of freedom and autonomy? But the point is having this peace of mind that I know that the business that I've built to this point is going to be okay. That when I either go on holiday or I focus on this new growth path, or I concentrate on changing some of my habits and behaviors, spending more time with my family, whatever it is that you want to focus on now to be a healthier person, a big step in that is making sure you've got the peace of mind that your business is going to be okay. And the way that we help our clients do that is we take them through a structured strategy development program, not to develop a new strategy for how I'm going to grow the business, because you're going to grow the business anyway, and you know exactly what it is that you want to do. But it's more about the fact that how can you get that thinking out of your head and build it into your team so they can execute it and they're clear, they can take the right initiative and ownership so that you can have the peace of mind that the team around you can take care of the business that you've built to this point. And I think that's the real difference maker. And where we are different to many other people in the market is that we create the sustainability of strategy execution within the team, right? And that's why we have a structured program. It's why we do weekly 2-hour workshops. It's why we provide the pre-read guides, the implementation guides, because how do we create this capability to do this sustainably so that you can essentially switch off and have this peace of mind? And we're so confident in what we do that we'll provide you with a money-back guarantee on the first 3 workshops. So if you didn't get the value you're looking for, we'll cancel the engagement, give you all your money back. The reason why we do that is because a lot of founders have been through strategy experiences and done different things in different ways about how to put together their leadership team, management team, guide the next step moving forward. But no one's really done it our way. So we want to give you this opportunity to, how can I get a sense of it before committing? And that's our promise to you, to make sure that you can actually get a taste of it before really committing to the path forward. Now, I'm not asking you to sign up for this. I'm not asking you to jump into marriage with me before we've already even met. But I am just saying that if this is something that sounds interesting to you, if it sounds like you're the kind of person that really wants to have a bit more peace of mind of your business, then at least reach out to me, right? Let's have a 30-minute chat. Let me get to know you. You can get to know me. You can find out a little bit more about how it works. We can see if this is something that's actually useful for you and something that you need. And then we can take it from there. We can have a strategy session with you and your leadership team. We can show you what it is that we do. We can see what it's actually needed in your business. And then after that, we can then get to proposal and we can think about committing later. But in the meantime now, if this is something that you're just interested in, reach out to me. Let's have a chat and see how I can help you achieve this sense of freedom and well-being that you're looking for within your business. And whether or not that is you that wants to reach out, my belief is that you still found a lot of value within this podcast. Otherwise, you wouldn't have listened for this long. So if this is something that you really enjoyed, if you got some really great insights from myself or from Emilian from this podcast, then please, the best way you can support this podcast is just to comment, share with your friends that you think would want insights like this. And that's the best way you can support us. That's the best way you can help us grow. And that's the best way you can help other entrepreneurs learn from other founders so you can avoid years of trial and error and really scaling a business and become healthier as well. But I guess that's it for me now. Thank you so much for listening to another episode of the Founder Files. I'll see you next time. Cheers.